Good morning, everyone. Bob Ravenscroft, the Vice President for Advancement. It is Thursday, April 16th, media briefing. With us today is Lisa Vail, the Chief Nursing Officer for Bryan Medical Center, and John Woodrich, the Chief Executive Officer of Bryan Medical Center. John's going to have we have a breakthrough on testing, believe it or not, that John's going to share with you. And then Lisa's going to talk about the visitor experience and a couple of cool things. Before the stats, I just want us to think back and remember Lincoln, how it was not too long ago. It was vibrant, energetic, progressive, and entrepreneurial, and it'll be that again. And if you back up to 2011, the Lincoln Chamber of Commerce had a contest for startups and entrepreneurs to test some concepts and ideas on how they would intersect with healthcare. A panel from Bryan and St. E's both evaluated the merits of their ideas and selected a winner. There was no obligation for either of us to continue beyond that point, but we really liked what the winning concept came up with. And it's now played a very significant role in helping us connect patients and family members together. And now, a few years later, almost 10 years later, it is playing a significant role in helping keep families connected through COVID-19. And it's really, really important to us because out of all of the decisions on PPE and everything else we've done, there's nothing that's been more really gut-wrenching than the visitor policies and keeping families and patients separated. So Lisa's going to give you an update on how that works, and it's truly playing such a vital role for us now. With that, let's get right to the stats. Our midnight census was 387. Out of our COVID screening questionnaires completed on Bryan Easy Visit, we're now at 9,401, resulting in 2,729 easy visits, and 1,262 have used the COVID promo code. We have now tested 1,606, 74 positive, 1,458 negative, and 74 pending. Lisa?
Good morning, everyone. Lisa Vail, Chief Nursing Officer here at Bryan Medical Center. As Bob said, we recognize how difficult it is for families and their loved ones to be separated during our visitor restrictions here at Bryan Medical Center. This is gut-wrenching for us as it is for you because we know how important it is for family support to help someone while they're going through a health issue. We do have some opportunities that we are utilizing within the medical center to try to keep our families and their loved ones connected. A couple of things internally before I talk about Noble is we have a wonderful pastoral care department who can address and visit with patients, looking at their spiritual needs and those concerns and issues. We can also find ways for an individual's personal religious leader, chaplain, preacher, priest to connect via phone or other ways with our patients. So that's a really important part of that spiritual well-being. We also do a process called rounding, and we use Noble, actually. N-O-B-L is the name of the company that Bob was talking about, Noble. We use this for a couple of different ways. We do leader rounding with each of our patients every day. And part of that questioning when we talk about how are you doing, we're really asking our patients from an emotional health perspective, how can we help you through this difficult time? Because we know it's hard to be separated from your loved ones. So we also then have a resource team that is going throughout the hospital. These are nurses and others who are our trainers for our PAPRs, our hoods, our positive ventilatory devices, and they are also assisting patients and families to connect via their electronic devices. So whether it's through cell phones, whether it's through tablets, whatever devices individuals have, we have a set of resources that are floating through both campuses to try to help them troubleshoot any of the technology issues so that they can stay connected, whether it's just a verbal phone call or whether it's a video chat, FaceTime, whatever that might be. So if your loved one is in the hospital and they don't have a device, but you have an extra that you would like to bring to them so that you can connect electronically, we just ask that you label it clearly, bring it to one of the front doors. One of our screeners at the front door will take that device from you and will deliver it to your loved one up in their patient room, and then we will bring in some resources to help them get connected so they can understand how to use that technology. One of the ways we use Noble, in addition to rounding and talking to our patients, is part of their software has a portal, and it's called the Friends and Family Portal. And this is a way where you, at any time of the day or night, can access your loved one's record, if you will, within this portal and find out a little bit about what's going on with your loved one in the hospital. It's a very simple way. You can go to rounding.bryanhealth.org. It does require a 4-digit password. Your loved one can give you that on the phone, over the phone, or one of our care team members can get that number for you with your loved one's permission. And then you can type that number in, and then you can see what's happening as the nursing staff do their hourly rounds for their patients' safety. So you might see comments in there that the doctor made rounds, or your loved one was sitting up in the chair, or that they ate their meal, or that they were medicated for pain, that they were resting comfortably, just kind of what's happening in their daily life. It's not going to be any specific medical information like vital signs or lab results or anything like that, but it's a wonderful way for you to be able to connect easily to find out how your loved one is doing. So again, reach out to us. Let us know if you would like to connect with that, and we can help you get that password so that you can connect using Noble. And again, the website for that is rounding.bryanhealth.org, and we'll help you with that any way we can. Thank you.
Thanks, Lisa. I'm John Woodrich, CEO of Bryan Medical Center. I wanted to share with you in regards to the patients that are here with COVID-19. We have 7 that have tested positive that are inpatients. 4 of those individuals are from Lancaster County and 3 are from outside of our county. Of pending, we only have 3 patients in-house pending results. All 3 of those happen to be from Lancaster County. Of the individuals in-house, of those 10, 3 of them are on ventilators. We have 6 in our intensive care unit, 1 in our progressive care unit, and 3 in our general care unit. And I wanted to share with you, and we talked about this a number of weeks ago, about us having the ability to do testing in-house here at Bryan from the prospect or the perspective of resulting. And now we have that capability. So we started this yesterday. We started with just 5 cases that we were able to result here, and we will continue that throughout the weeks ahead. We're starting right now just with inpatients for doing the testing there. As we continue to get additional supplies, we have about 200 kits available to do that resulting. We have orders to come in. We will open it up more broadly after that period of time, but right now we're focusing on those more severely ill patients that end up coming in as an inpatient to get those tests done and the results. When you run a batch of these tests, we're able to get a result here in roughly 2.5 hours. But then you look at the number of tests that you're running at any given time, so you can't just assume that if you were swabbed 2.5 hours later you'll have a test. It's the way that you have to run these with the cassettes that are utilized, and we want to make sure that we take advantage of utilizing them in the appropriate way when we're doing the testing. So we will start out very slow, but as time goes on, we will continue to do more tests in-house. I did want to share and reference back, we have made some really good progress with our third-party lab, and we only have 74 pending tests right now. 62 of those were done at the drive-through yesterday, so that's just can give you an example of how quickly they're coming back now. So we're seeing a tremendous difference. We actually have 0 pending tests from anybody that's gone through our urgent care center. So really good progress with our labs. I think the system is getting down more readily for people, and we're feeling more comfortable at this point in time. that we can service individuals. And I want you to recall again, we mentioned we can go up to 110 tests through our drive-through, and we're still about in the 60s range. So if people are feeling there is a need that they go to their physician and get screened, we have the capability of testing other people through our drive-through.